So first, let's talk about what hemodialysis is before we start talking about what happens when you get there. Hemodialysis is a medical treatment for patients whose kidneys can no longer filter out waste from your blood or excess fluids from your body. So what happens is your blood is, you're connected to a machine and your blood is pumped into the machine. It's called a dialysis machine. The machine filters the blood, it cleans it, then it returns it to your body. It also takes out excess fluid. This process happens multiple times while you're sitting there. Usually you sit there for about 3 to 4 hours, and it usually happens multiple times a week, 2 to 3 days a week. Every other day is when you usually go. So now let's talk about what you can expect on your first day. So on your first day, you need to basically check in. You get welcome for registration. You arrive at the clinic, you'll be greeted by the medical staff, you'll be greeted by the administrative assistant, you'll be asked to fill out a lot of paperwork. Don't be overwhelmed, but it's a lot of paperwork. The paperwork would include your insurance information, your medical history, emergency contact information, things like that. Just details that we need to have. Secondly, you'll get an assessment. So once you're done registering, you'll be taken to a private room where a nurse or a technician will do a physical assessment on you. This includes taking your blood pressure, taking your weight, taking your height, taking your temperature, and it also check for signs of infection or any other complications that may interfere with dialysis or that they just need to make note of. Next is your vascular access. Vascular access means the point of entry where you will be connected to the machine so you can initiate hemodialysis. So most likely you have a CVC, which is a catheter that's in your chest that goes straight to your heart. Eventually you may get what's called an AV fistula or AV graft, which is a fistula is your blood and artery combined together so they can put a needle in there or 2 needles in there to do your treatments. A graft is if they take a plastic tube and they put that tube inside of your arm, and they put 2 needles in that, and it allows you to connect to the machine and start your treatment. So, but you most likely have a catheter that goes to your heart. Sometimes catheters are in your inner thigh as well, but those have a high risk of infections, and that's only down there if it's absolutely necessary, if they can no longer put it in your heart. So the nurse will answer any questions that you have. They'll talk to you about your access. They'll talk to you about your other fistula or graft that you may get in the future, and then they're going to bring you to the machine. So once you have once they look at your vascular access to make sure it's great, the nurse or tech will show you to your chair. You'll get comfortable. They'll take your blood pressure again. You'll lay out a blanket or something like that, and there'll be a TV in front of you. It's either connected to the chair or it'll be like up high. You could change the channel with the remote that they give you. And while you're getting comfortable, they take your blood pressure. They're cleaning your access site, and then they're getting ready to connect you to the machine. Now, while you're connecting to the machine, you shouldn't feel anything. You shouldn't feel the blood leaving your body. You shouldn't feel the blood returning to your body. The nurses and techs are constantly monitoring you, even if they're not next to you. They can see on a computer how your treatments are going, how your blood pressure is, your heart rate, and your other vital signs. They're going to go to you constantly to make sure that you're comfortable, make sure that you're not too cold, you're not experiencing disequilibrium syndrome, you're not having any adverse reactions, you're not allergic to the dialysate machine or anything like that. So they're also going to manage your medication and fluid. So you may experience some side effects during hemodialysis like low blood pressure, cramping, and the cramping is usually, and the low blood pressure is usually due to rapid fluid being removed and toxins being removed from your body. The nurse or tech will monitor this, and they'll make adjustments to the machine to prevent any further complications from happening. And they may also give you medication during your treatments as well. Now, once you're done with your treatment, the technician or the nurse will disconnect you. They'll look at your site, they'll assess your condition, they'll take your blood pressure again. If you have a fistula or a graft, they will put pressure on the points where they remove the needles to stop any bleeding. If you have a CVC, they'll just clean that up, and they'll put medication inside to prevent clotting, and they'll secure it for you, and they'll tell you don't take a shower. So that's pretty much it. Usually it takes about 3 to 4 hours. Post-dialysis care, before you leave, you have to take another blood pressure and have to take your weight to see what your difference is between when you first got there in weight and when you leave there with weight. How much fluid did they remove from your body? The nurse will give you post-dialysis care instructions to let you know what you should do and what you shouldn't do. This may include like dietary restrictions, medication schedules, warning signs to watch out for in case of infection. If you have a fistula or graft, they'll let you know not to let any nurse or doctor access that site. It's only for dialysis. And that's pretty much it. After that, you go home. You may feel exhausted. You may feel drained. You may feel tired. That usually happens after hemodialysis. It's something to get used to, but people have been on it for years and they still experience it's the same thing once they're done with the dialysis. Just know that it's to clean your blood, like it's for you. It's something that you desperately need. Don't worry if you feel overwhelmed. Everyone feels overwhelmed initially. It takes time to get used to it, but just follow instructions by your nurse, your doctor, your dietitian, your social worker, your medical team to ensure that you have a successful recovery. And on your following visits, you'll become more accustomed to the process. Staff will continue to monitor your progress. They'll make adjustments as needed. So, it could be a little, what's the word, daunting at first, but knowing what to expect can definitely reduce your anxiety. Don't forget to bring a blanket just in case you get cold. And you can always ask your medical team any questions that you may have. Hope this answers your question. Take care. Ciao.